And now I'd like to call up Senator Urso to introduce her bill.
Thank you very much, Rep. Spears. Last month at the AI Summit in Paris, our Vice President was quoted as saying, "AI's future will not be won with hand-wringing over safety." And I think that really underscores the position of laxity that the federal government has taken with regard to this technology and the motivation that that provides the states to really step up to protect citizens. Rep. Spears and I are working together on two bills. One bill, 2195, will set regulatory provisions for developers and operators of AI, and particularly companion technology or chatbots. Now, 47 attorneys general, including ours, put chatbot developers on notice of their expectation of protections for users of these systems who are minors. And we know that we have had several tragedies in this country with minors who are using chatbots for advice and counsel and who have not been appropriately discouraged from engaging in self-harm. But we also know that adults are turning to these systems as they're facing loneliness, depression, and other conditions, and they are equally vulnerable to the dangers of these systems. So that's the motivation for 2195. 2197 looks more at the use of AI and companion technology in the field of mental health treatment, really for the protection of user privacy and safety. Privacy because it's really not clear to us how the data collected by artificial intelligence is secured. And so a catastrophic failure in confidentiality could be devastating to an individual. And we also know from a study, a collaborative study of large language model chatbots that was conducted by Brown University, Louisiana State University, and the Cognitive Behavioral Therapy Center of New Orleans, that these systems routinely violate core mental health ethics standards as prescribed by the American Psychological Association, even when they're prompted to use evidence-based psychotherapy techniques. So we want to be careful that there is a careful implementation of the technology if that technology is going to be used in direct patient interactions. So I'm very pleased that we're working together on these bills. We heard them in the Artificial Intelligence Committee last week, and we're certainly going to make every effort to move them forward. Thank you.